Christine, we've asked to share some of her recent experiences with telehealth during the pandemic.
Sure, and I'm actually going to let my partner introduce us first, and then I'll tell my story, and then I'll hop back in, so.
Thank you so much, Christine. Yeah, Christine and I actually met recently because I reached out to her for her perspective, and she invited me to participate in the meeting today. And throughout the course of the last, 9 months, me and my team have been directly trying to bridge the gap between some of the issues that you've talked about as far as a health tech divide. And I'd be happy to share and kind of carry like piggyback on what Christine shares, but happy to be here.
Perfect. Thank you so much. So again, my name is Christine von Raesfeld, and like we mentioned, I'm founder and CEO of People with Empathy. We're a nonprofit dedicated to breaking down silos in healthcare. But first and foremost, I am a person living with multiple autoimmune conditions and rare diseases. So like most patients, COVID has been an extremely difficult period for me. And as I have said to many of you, mentally, I think I can survive a pandemic, but physically, I'm not sure I can. Personally, I can tell you that living with an invisible illness is difficult. Add to that misdiagnoses, lost records, toxicity from medications, and just an overall feeling of not being heard. And my entire life has been an uphill battle. A fight to prove that I am sick, despite my appearance, and this pandemic has actually made that worse. As a maintenance care patient, I require a multidisciplinary approach to assessment and planning, one that's not always possible via telehealth and technology. While each has proven to be beneficial, there are limits to what can be done virtually, and it's something that needs to be discussed. Despite the limited in-person care that I have received, I've become $1 million Medicare patient this year alone. Though I believe this could have been avoided just going back to a simple in-person evaluation. A little bit of a backstory for you. I started 2020 with a mysterious lung infection that slowly progressed. As the months went on, I started to develop symptoms of what I thought was narcolepsy or chronic fatigue syndrome. Not related, and also new neurological issues not related to my current conditions. I sought help, from multiple physicians in different areas of specialty. And after 8 ER visits and 15 plus telehealth appointments, I was screaming for help and ready to give up. I had been monitoring my own symptoms at home since they never seemed to show up when I was being watched, though I do see potential problems in that as well. Long story short, after repeated dismissals from several physicians, I was diagnosed with a rare genetic heart condition, left ventricular non-compaction, and was told that I was at risk for sudden death. I received an automated implantable cardioverter defibrillator within 5 days after being told for months that I was okay. Unfortunately, this isn't the only time I haven't been heard by my healthcare team, the people who are supposed to be there to help me. Someone recently commented that I must have had an amazing team to be able to diagnose my recent conditions, but in all honesty, it's been my own persistency and the help of others. Psychiatrists, nurses, physician's assistants, and friends in the healthcare industry that have led me to some of the answers I've been searching for. But it's far from over. Not listening to patients can not only cause significant increases in healthcare costs, as we've seen in my own example, but also significant damage to the actual human life that we are trying to save. In our attempt to save someone with the newest technology, we need to consider the individual, the quality of life they had, and the quality of life that they will have, and need to see them as people. While it's important for us to set guidelines and modify requirements for telehealth, we need to take into consideration the many disease states that people may be in. As we move forward, it's imperative to consider each patient's individual resources, education levels, disease state, but also the future potential to upkeep their care and what it means to that person. Oftentimes we look to technology as the answer when instead we should really be looking to humanity. So how can we build better relationships with patients to use collective intelligence and collaborative leadership to find viable solutions that will work for us all? With that, I'll turn it back to Idean and get his perspective on how we can do this together.
Thank you so much, Christine. Everything that you brought up is so important. These are things that we should have talked about before COVID, but COVID brought it up and put a spotlight on it. There are some obviously visits that you really need to have in person. A physical exam, just even an empathic conversation in person makes a difference. But one thing that we've noticed is that in some regard, it is convenient for some patients to avoid having to deal with leaving their house, for certain patients, leaving their house, parking their car, getting to the clinic. Being able to stay at home, especially if the physician or the clinicians are behind schedule, rather than waiting in a waiting room or in the exam room, they can be comfortable at home and just wait for a phone call or a Zoom session to begin. There are some benefits to that, and it can allow perhaps quicker visits, more efficiency, and more follow-up for certain things. But of course, as I mentioned, there's a tech divide, there's a digital divide. There are certain patients who do not own any device that you could appreciably conduct a virtual visit. And some people, even if they have that device, they're not aware of how to use it. Age plays into a factor, socioeconomic factors play into it, and education levels. There have been certain instances in which one particular patient was able to use FaceTime on their Apple device because they spoke to their grandchildren on it. But in order to share a screen, we had to load Zoom onto their device. So I used FaceTime, and she would show me her screen, and I would help her download Zoom and get that running. And as Christine mentioned, that's where humanity comes into play. We have to have a team of people who have the time and the patience and the know-how to help these patients bridge that gap. It's something that really has been palpable, but it should be addressed. There are some providers that prior to the pandemic were using telehealth more so than others. And as I mentioned, it leads to efficiency. But at this time, humanity may want to look into providing these devices to people who don't have them, because I think the benefits really would be huge on not only a healthcare level, but an emotional connection to their loved ones to help prevent things like depression or other mental health issues. So definitely, it's very important. I think it's more palpable now, but as we continue, I hope that lessons that we've learned during this time aren't forgotten and we just go back to our previous ways. I'll let Christine.
Yeah, and then to touch on that, we had a conversation ourselves on basically devices and remote monitoring and things like that. And we also see the instance of educating patients, right? Because I do see that if we come up with a watch that's going to monitor your health or your heart, and that doesn't come through, I see issues, on two ways. One, that patients now will read into the results that they're seeing without the proper education or knowledge in the devices that they're using, and then inundate doctors' offices as well with things that may not be significant. So we've had the talk on how do you teach people to use these resources in a way that will really benefit them and not cause, we already know that doctors don't have enough time to sit down a lot of the time. So how do we, and I do think at some certain point involving patients, bringing patients into the procedures, into bringing them into just walking another patient through a disease space would be helpful and would take some of the pressure off of some of the healthcare system and give patients a purpose at that point.